I appreciate your testimony this morning, Mr. Slavitt. Thanks for all your information. With regard to the lock-in program, this is critically important for Ohio and other states right now. We have, as you know, this heroin epidemic. On average, we're losing 20 people a week in Ohio to opiate overdoses. Most of it is now heroin, but most of it started with prescription drug abuse. And so what we're trying to do is simply make it harder for people to be overprescribed, both because we don't want them to be able to sell those pills on the street, which happens, but importantly, so that they themselves don't become addicted through this overprescription. And one way to do that is to lock in under Medicaid as we do under Medicaid. So this is part of a much broader answer. We have legislation, the Comprehensive Addiction Recovery Act, which we're also trying to move. But I thank you today for your stated support of this legislation. I urge the committee to move forward on marking this legislation up. With regard to the co-ops, I have lots of questions, and I guess the key for me is how could this have happened, and what can we learn from it? As I look at it, it's a program failure. It's wasted up to $1.2 billion now in taxpayer money. I heard you say earlier you thought some of that money might be recouped. I would make the point that, to my view, none of it's been recouped, zero. These are failed enterprises. So I think saying $1.2 billion has been wasted is probably accurate. That's enough, by the way, to pay for health care premiums for more than 300,000 Ohio families in 1 year. You know, it's our job to be the oversight committee here and to find out what the heck happened and how could it have happened, particularly under the purview of HHS. I think we could have protected taxpayers better. We could have protected these patients better, many of whom were finding themselves without any coverage because their co-ops failed. And instead of canceling loans or reducing loans to deal with these failing co-ops, as I look at it, HHS actually accelerated so-called solvency loan payments for these failing co-ops. And some of this may have happened before your time, some after your time, but the point is that HHS, in my view, did not provide adequate stewardship over these co-ops. Let me clarify a point in your testimony. I read that you say that 85% of the $2.5 billion in co-op loan funding was awarded, and this is a quote, before coverage began on January 2014. I don't think it's true. I believe it's true that more than half of that $1.2 billion in taxpayer-backed loans received by the failing co-ops we talked about, the $1.2 billion that I would argue is essentially wasted taxpayer money, was actually dispersed after January 2014. Would you like to comment on that?
So I want to make sure I get your words correct. There may be a difference between awarded and dispersed, but the loan awards, 85% were, in order to have enough capital for them to enter the markets, 85%, and as you would say, this was a little bit before my time, but as you say, 85% of the loans were granted, and then they were dispersed on a schedule to move the capital as soon as the co-ops needed them to support the business that they'd written.
I think if you look at the public financial statements of these co-ops, you'll see a different answer, which is, again, that more than half of the $1.2 billion that was loaned to co-ops that have failed was actually received by these co-ops after that 2014 date. I would encourage you to look at those financial statements. They're public. Throughout 2014, HHS was writing a series of multi-million-dollar checks to the co-ops. As they were doing that, exactly what financial indicators did HHS review to make sure that each loan disbursement continued to be a sound investment? What were you looking at?
Again, I think we probably want to get together to make sure we're looking at the same sets of numbers. But I think there were approximately 15% of the loans that were granted during the course of 2014. Again, before I became acting administrator, so I'm a little bit of tracing history here. But I have looked at the paperwork and the documentation, regardless of what the number is, that the companies went through as and they were, very extensive applications, required third-party review, required, in-depth evaluation, and while it wasn't the largest portion of the funds that went out, these were funds that went out at a time when the solvency needs were really, I think, driven by the size of the business. The other thing I'd point out, Senator Portman, in focusing on the people that were making the decisions at that time in 2014, this was obviously before there was even a full year of financials and the way, of course, claims work in the insurance industry, a very limited amount of claims information to work from. So I think that the decisions were made with the best information that folks had. I would say it wasn't until the first and second quarter of 2015 that at least I felt we started to have a really good picture
Well,
of the
I have to
profitability.
interrupt you for a moment because my time is expiring. We have a vote on it, as you know. In addition to that, let me just say this. There were monthly reports concerning enrollment, net income, and medical loss that were available to you. These are publicly available documents. They showed that every single one of those co-ops that failed was not just losing money. All of them were losing money. This is why you're providing this taxpayer money to these entities. It also showed they had dangerously high medical loss ratios. So you're saying we needed to wait. There was no good information. It was all negative. And so I think, these are the kind of financial red flags that any prudential regulator would have looked at, and I think HHS blew it. And so I don't have time to go into further detail now. I would love to get together and talk more about this. As you know, we're doing a more in-depth investigation of this issue. But the point is to avoid going forward losing this kind of taxpayer dollars, and also having the very real issue of these patients losing coverage. Ohio, probably to our benefit as we look back on it, started slow. And that first year, we couldn't get approvals, and as a result, we only got about 15% of the enrollment that we expected. As a result, we're not in as bad a shape.
Right.
But these other co-ops, I think this was terrible management, and I think we need to ensure that we have better management going forward, and I think we need to look carefully at what happened and why. Thank you, Mr. Chairman.